so the geek in me, I was reading that there was some learning from other industries which sort of inspired this innovation. So kind of there was, I guess someone looked at the gaming world and how it
Yeah,
worked. So tell me a little bit about that. So the geek in me, first, the patient side is so important, and I love to hear that. But now the geek in me is like, ooh, how did this influence, that innovation?
absolutely. Well, it's that old quote, right? Artists copy, geniuses steal. So when Dr. Goldberg figured out the type of test that needed to happen to understand the function and what's going on with the patient, that was just the first step. Because in this at home atmosphere, you can't control for some of these very important variables. What position is the patient's head in? Can you see where their eyes are moving? How close are they to the screen? What's the lighting like in front of you, behind you? And without controlling for those variables, he couldn't get a program that was really accurate and repeatable. So this is very frustrating. But he said, if I could just track those parameters, it would be so much easier. So he started looking around and doing some searching in the tech industry. And oddly enough, there was a gaming company who had all these patents around tracking eyes and head and position to relation to the screen for a better first gamer experience. First player as you're in a virtual reality situation. And by combining these together, Dr. Goldberg and the founder of that company were now able to create a system that tracked for all those variables. So we had to reach outside what we knew in the basic technology that we'd been going down on a path in this area for 50 years and just reach outside to something that was already developed. And you had to open up a little bit and go, where are the adjacencies here? Who's really doing what it is I need to be more effective? And the thing is, healthcare has always benefited from this. If you look in eyes alone, the device that most doctors use to remove cataracts today, overwhelmingly, actually came from the dental industry. So it was an inspiration because the doctor was in the dental chair trying to figure out a technology to take out a cataract. And so he adapted it. And this is again, 40 plus years ago. But now it's so efficient and it's so good that it's the number one surgery performed in the world and it's the safest.
Wow.
So always looking outside and looking for those tech adjacencies has made huge differences. And I've been lucky to experience a couple of them in eye care.